Good morning. Welcome to our health and well-being event, co-organized with our partner Piestani and Smaki and Sana Spa Hotels, András Schuster. Thank you very much for coming and being with us today. While healthcare systems around the world are under immense pressure to deal with successive waves of COVID-19 and catch up on the care backlog, they are also facing a long-term challenge: how to create the resilient healthcare systems that will be needed to cope with future pandemics and climate change. We are very excited to bring you this event and honored that our event is opened by His Excellency Nigel Baker, the British Ambassador. And we also welcome Peter Jančovič, the Mayor of Piestani. So, Mr. Jančovič, please come. Thank you.
Dobrý deň, dámy a páni, dovoľte, aby som vás privítal v meste Piešťany, v našom nádhernom kúpeľnom meste. A téma, ktorou sa dneska budete venovať, nie je o tom, že sme kúpeľné mesto až tak, a nie je o tom, že ste v nádhernom meste, ale téma, ktorá sa budete venovať, je vážna. Aj o pandémii. Ja možno len tak v krátkosti. Máme veľmi dobrý vzťah s kúpeľmi ako mesto a myslím si, že to je správne, pretože ak sú dva silní partneri, tak je to správne. V meste Piešťany sme dokázali spraviť vakcinačné centrum v Piešťanoch a znamenalo to aj výraznú mieru zaočkovanosti v našom meste, čomu sa veľmi teším, ale na Slovensku vieme, ako je Slovensko na tom, takže ešte by sme potrebovali zabrať celé Slovensko a to všetci vieme, pretože ak nezaberieme, tak tá situácia bude pokračovať tak, ako je a tá situácia nie je veselá. No a tá situácia nám sťažuje všetkým život. Určite dnes budú hovoriť kúpeľ o tom, ako im to sťažuje podnikanie, ale keďže podnikateľský sektor a samosprávy sú spojené nádoby, tak aj pri nás je to tak. Ja momentálne, dovoľte, aby som sa ospravedlnil, ja vás privítam a potom idem, viete, ďalej pracovať na rozpočte. Všetky samosprávy teraz zostavíme rozpočet. Možno som v tej téme teraz tak zahlbený a spomeniem jednu vec. Kúpeľné mestá sú mestá, ktoré nemajú priemysel, majú priemysel, nie v takom veľkom množstve. To znamená, že nemajú také veľké dane z priemyslu ako priemyselné mestá. A hlavná noha ekonomiky je postavená na cestovnom ruchu. A jedna z hlavných tých taxí, z tých daní, ktorú máme, je daň z ubytovania. Ročne Piešťany vyberú tak 800 000. Na pol roka sme mali plnenie 10%. Problém je v tom, že neexistujú žiadne opatrenia, dofinancovávanie smerom zo štátu. To znamená, že si musíme s tým vystačiť. Ale vy viete, že keď prídete do kúpeľného mesta, potrebujete, aby všade bolo pozametané, aby všade boli kvetinové záhony, aby mesto bolo vyčistené, aby vyzeralo pripravené na kúpeľných hostí, pretože kúpeľní hostia nechodia len po kúpeľnom ostrove, ktorý je krásny, ale aj chodia aj po krásnom kúpeľnom meste. Mohli by sme pokračovať a pandémia nám pripravila okrem tých strašných príbehov, ktoré sú často ľudsky veľmi tragické, nám pripravia aj ekonomické problémy a viem, že aj tomuto sa budete venovať. Toľko som chcel možno len na úvod a viem, že vás čaká veľmi ťažká téma, preto vám chcem popriať pri dnešných vašich diskusiách veľa síl, veľa príjemných a inšpiratívnych nápadov a príjemnú diskusiu. A som veľmi poctený a som veľmi rád, že v našom meste sa koná takéto stretnutie. Vrele vás vítam a ďakujem za to, že ste tu. Prajem vám všetkým pekný deň.
Thank you very much indeed, Pan Primator, for being here this morning. My wife is from Piešťany, so I always feel at home when I come here. My name is Nigel Baker. I'm the British Ambassador to Slovakia, and it's a real pleasure, I have to say, to be here for this event, Health and Wellbeing during the COVID-19 pandemic, joining those of you who could make it in the room, and I know the many people we have online today. First of all, I'd like to thank our hosts, András Schuster from Piešny and Smrdaki Ensena Spa Hotels and his team for co-organizing and hosting the event together with the British Chamber of Commerce. Thank you very much indeed, Heine. For me, it's always a real pleasure to support Ensena Spa Hotels, one of the major UK investors in Slovakia, owner of Piešny and Smrdaki Spa. As the mayor touched on, their industry was one of the most affected, has been, by the COVID pandemic and the various lockdowns and restrictions, but they've managed to maintain employment, keep operating thanks to innovations like opening testing and vaccination facilities on the Spa Island, a really important vaccination center for the region here, and developing their offer to customers, for example, creating new well-being packages for Slovak families. I think a really good example of how private companies can adapt and take decisive action when faced with a challenge of this scale in the healthcare sector. Also really looking forward to hearing from the influential panelists today, who, as well as Andrea Schuster, will include Martin Pavelka, epidemiologist. The Ministry of Health will also give us a short presentation on the COVID automat. Darren Wilson, General Manager from Warsaw, Slovakia, and Kuno Vaher, Cluster Director, Central Europe for AstraZeneca. I mean, I'm really happy to see AstraZeneca, another British company, and Roche, an equally important player within the healthcare system, among the panelists. I think for one, unfortunately, as we know, there's another pandemic coming, not a COVID one, but one that's beginning to show elsewhere in the health system. It's a pandemic of those whose treatment was put to one side because of COVID-19. It's a pandemic of cancer, of diabetes, asthma, cardiovascular diseases. One that can only be dealt with, I think, through much tighter cooperation between the key players, with the eye, of course, with our main eye on the good of the patient. Prime objective, whether in the health sector, the well-being sector, tackling these challenges. And to achieve this, I think we really have to root for and support the innovators like AstraZeneca and Roche, and enable them to introduce the best and newest medicines through the private sector, through the public sector. I'm also very grateful to Martin Smetana, Associate Fellow Health, Economic Growth and Sustainability Program, who will be moderating the discussion today. And he knows better than anybody what a difficult time it's been for healthcare and healthcare specialists. The pressures on the system, of course, and what I regard as the really entirely unacceptable attacks on healthcare specialists, experts who have been doing an amazing job in the circumstances of enormous pressure, public pressure, and pressure from governments and societies through this pandemic. And I think that's one reason, this pressure on those people working in the health system, why international cooperation is so important, working together, finding solutions together. And I'm really pleased that actually our two countries have been working very closely together in the field. One, if I can call it that, positive benefit of the COVID pandemic has been strengthening that sort of cooperation and engagement. The companies I've been mentioning, of course, who have been working extremely hard with governments across the world, including the Slovak government. But not just them. Also, for example, in the UK, nearly 1,000 Slovaks working in our National Health Service. We're incredibly grateful for all that they do, day in, day out. From the very highest level of the British government, we had a visit in October last year from colleagues from number 10 Downing Street, who had really deep interest in Slovakia's national COVID testing regime. And there were some excellent exchanges at senior levels, as each country has to see how other countries are doing and compare notes, because we're all experimenting under the challenge we're facing. A lot of sharing of data and best practice between governments, between our governments. And also, for example, Public Health England signed a contract with the Slovak company Multiplex DX for diagnostic COVID tests. So it's public to public, private to private to public, private to private, a huge amount of cooperation going on. And actually, healthcare diplomacy has become a big part of what my team at the embassy does. Last month, I was honored to host senior representatives of the Ministry of Health and other distinguished guests at a special roundtable event at my residence, organized to address issues, common issues we face in the healthcare system and discuss important new initiatives. So looking at areas of cooperation like policies attracting innovation, building new healthcare and health tech ecosystems, and digital solutions for Slovakia's healthcare. More initiatives, more dialogue, I think, between stakeholders always helped. And we at the British Embassy will continue our work facilitating those sort of connections. There's always more we can do together, I think. So really looking forward to today's discussion. And it's really important we remember to seize the opportunity, not just to tackle existing problems, but building back better in a sustainable way. And therefore, finally, it would be really remiss of me not to mention that the UK is hosting the COP26 Climate Summit next month in Glasgow. We've all got a duty to play our part in combating climate change, a major existential change, another major threat, in a sense, to our societies. On 1st of October, NHS England actually announced that they were joining the United Nations Race to Zero commitment to achieve net zero greenhouse gas emissions by 2040, the first national health system in the world to commit to net zero carbon emissions, and the first major health system, public or private, to make a commitment of this scale. I'm therefore really pleased that we have with us online Sonia Roznik, who's the International Climate Policy Director for Healthcare Without Harm, a global leader in environmentally responsible healthcare, who also has worked very closely with the NHS in this endeavor. I think Slovakia is well placed to build back better. You have a recovery plan with support of EU money, EU funding, foreseeing €1 billion worth of investments for healthcare systems. And I know that private providers like Piešný Spa are looking at what they can do to contribute to the zero emissions goal in that longer term sustainable development. All of our distinguished guests here today and panelists will be at the heart of this important work in building a resilient healthcare system for Slovakia. And I wish you well, and the UK stands ready to work with you. So looking forward to this event, hearing ideas, collaborating, fostering further cooperation, and I wish everybody a very fruitful discussion. And it's my pleasure to pass the floor virtually over to Sonia Roznik online to talk about her experience, particularly in sustainable healthcare in the UK. Sonia, over to you.
Thank you very much for that kind introduction. I'm delighted to be with you today, and sorry that I can't be, with you in person. I guess my advantage is that working for sustainability, you can join in digitally to so many different places. And that is one of the big lessons that we've learned through the COVID pandemic, is that actually there are ways that we can manage situations in creative and innovative ways. So thank you very much for the invitation. I'm a healthcare professional myself. I worked in senior management in a large teaching hospital in the NHS and worked on sustainability for the NHS for the last 15 years. And I would just like to highlight how important it is for the health sector to tackle the pandemics that have been mentioned. So we've both got the COVID pandemic, we've got to the health sector pandemic of all the sort of care that needs to be brought together now to ensure that we can be as healthy as possible. And I would like to add that for me, the climate crisis is a health crisis. It's akin to a pandemic as well. And it will bring significant issues to all of us if we do not choose to tackle the recovery from the pandemic in a way that is sustainable and resilient. And what I'd like to say really is that you're not alone on this journey. There's a lot of people who are trying to do the same thing, trying to tackle how we manage the COVID recovery well, how we build resilience, and how we decarbonize our health sector and our wider society. And so the NHS did take this important step during a COVID pandemic to develop a plan, a very detailed plan about net zero, which includes not just the emissions that come from the health sector in terms of the buildings and travel, but also incorporates the emissions from the supply chain, of which many of you will be part. So it's important to note that the supply chain of any health sector is quite significant in terms of carbon emissions. It's often over 60%. And that's because we utilize a lot of products naturally for what we do. And we have spikes where we use more products, like all our protective equipment during pandemics, which is so crucial. And so the NHS commitment incorporates reducing emissions in the supply chain. And I'm very grateful to Roche and AstraZeneca for taking on this challenge as well, because there's no way that any health sector like the NHS can do this alone. We need everybody to be working together to do that. Healthcare Without Harm has partnered with the UNFCCC around Race to Zero, and we have, a lot of other countries and a lot of other healthcare organizations that have joined up. So there's over 53 other health systems that have joined, which covers over 11,000 hospitals and 20 countries. So there is a lot of momentum here, and a lot of that has been built on the sort of ambition that has been shown in the NHS, that it is possible for a health sector to go to net zero carbon emissions, and to do that in a very systematic and evidenced way. And some of that is about the things that have already been talked about, how we might move more towards a digital setup. During the pandemic in the UK, we moved very, very quickly to make sure that GPs could do their contacts with patients online. And that change was a change that the United Kingdom wanted to put in place before the pandemic, make sure that we moved more to digital care where it was appropriate. And the pandemic accelerated that change, and in a way gives us hope that we can change quite fast and quite deeply when we really need to. So I'd like to also encourage you to work on all of the innovation that you can find across the public and private sector, in partnership between countries, to develop more digital care, eco-technology, and new ways of working, because we will need all of those. If you look at the carbon footprint of the health sector across the world, it is 4.4% of the overall global emissions. So that's akin to a large country. If it was a country, it would be number 5th in the world. So it is pretty significant. And then in UK, the NHS represents 25% of the public sector. So we can say that this is a big industry that really needs to tackle what it does. Where I feel very privileged is that working in the health sector, I truly believe that by focusing on good health and building resilience, whilst going to net zero, we can actually improve health and improve the quality of our care. And it's that conviction that drives me to get up every morning and to do more. So I just want to encourage you all as businesses to take the opportunity to join Race to Zero as well. There are overall across Race to Zero, there are over 4,000 companies that have joined. There's over 200 investors, nearly 800 cities, 799, and there's 136 countries represented. So there are a lot of people and a lot of companies and a lot of hospitals who all have committed to take this journey together. And we will need all the partnerships and all the innovation we can find to make sure that this works and we do this in a truly healthy way. I would just like to tell you about one more initiative that is going on in the build up to COP. And that is that the UK government, WHO and Healthcare Without Harm are working together to seek country commitments for their health sector to reduce carbon emissions and to build resilience. And we hope that we will have a number of countries, big and small, from around the world who are also declaring a zero target around their health sector. So I guess this is really to highlight that whether it's at country level, whether it's at system level or company level, everybody is trying to work to, reach zero carbon emissions and build resilience. And many people understand that this is the only way that we will be able to recover and build better for the future after this pandemic. It's worth saying that this is unlikely to be the only pandemic, and the more we are prepared for the future with these things in mind, the better we will, the more fit for the future we will be. So I would just like to add my voice to encourage you all to really reinvent health systems in a sustainable way, and that there are so many different components there, but I do believe that they intersect and can build on each other. So as an organization, and I know across the UK, everyone is very keen to support this direction of travel, and I hope that you will all be on the journey with us. Many thanks. So I'll hand over back to you now, unless there are any questions.
Thank you very much, Sonia, for your encouraging words. It's lovely to hear from you, and I strongly believe that collaboration is key to make the route to net zero happen. And that's why it's great to have a strong panel, a strong panel with very strong panelists. And if you have any questions, please. Yes. Microphone.
Thank you, Sonia. It was an amazing presentation. Thank you so much. I like how you pointed the supply chain. I actually didn't know that the NHS's supply chain constitutes up to 60% of the carbon emissions. It's quite a high number. Could you maybe talk about the biggest polluters in your supply chain and how you're going to tackle them? You're going to switch to different suppliers, or just to give us a more insight into this? Thank you.
Thank you. So the supply chain is hugely important. It is, 60% is a low estimate. It's higher than that. And if you think of pharmaceuticals, it's over 20%. The difficulty is actually trying to get exact numbers is pretty hard, because we're all learning how to do this well together. And the supply chain of the NHS and the health sector, they will all have their own supply chains as well to deal with across the world. So and I guess there are different elements to it, because what we're all learning is that different products have got different potency of carbon emissions. So just to highlight two that are very relevant to the health sector is anesthetic gases are very potent gases. Some of them are more than 1,000 times that of carbon. So the way we utilize anesthetic gases in the health sector is incredibly important. And what I've found on my journey is that anaesthetists were not aware of the potency of anesthetic gases until quite recently. And they've been changing their practice to use different gases, because they can do that in a clinically safe way to reduce the flow. And also, I know that there's innovation in technology to recapture those gases so that they don't just go out into the atmosphere. So there's lots of room for solutions through the way we change our clinical practice, but also through the way companies and the supply chain can help us find better solutions. The other one is inhalers. For inhalers for asthma that people utilize, they're incredibly potent as well. And in fact, if you consider an inhaler, the gas that's in it is 98% of the carbon footprint of that product. And there are other ways of being able to administer inhalers, be it in powder form or using springs. Again, it's an example of where some kind of eco-innovation is absolutely necessary. So when we say the highest polluters, it's difficult because we're still learning about which are the products that contribute most. And we've discovered that in medicines, anesthetic gases and inhalers are very high. The other thing that's high in some products is the plastic packaging for tablets, because you've got plastic on one side and aluminium on the other, and there's been good reasons for that, but it means that it's very difficult to recycle. So we all need to, in a way, the spirit of this is that we all work together to understand better the carbon footprint of all of these different products and the way they are utilized, and try and come up with better solutions. So the way the NHS is tackling this is to highlight to the supply chain that there is a commitment to net zero, and that there's an expectation that the entire supply chain of the NHS will join this. And they're being given, the supply chain is being given a long lead into this by saying that if by 2030 you're not well on the journey with us to net zero, then you may not be a supplier of the NHS anymore. So there is a lot of time. Well, there's not much time, 10 years, but there is a recognition that we need to work together to find better solutions and to reduce carbon in products. And that's, some of that's in manufacturing, some of that's in transport, some of that is in the way they're utilized. And we will need to do some research together to better understand some of those. I would just like to add one further answer to that, is just in terms of, for instance, another innovation. If you think of glove use, the non-surgical glove use, we recognize that that's not just about the product, it's also about how it's used. And Great Ormond Street demonstrated how through working very closely with their health professionals, they could reduce the unnecessary use of gloves. And they saved 7 tons of plastic in 1 year in one hospital, just by being more attentive to that. And so, you know, this is truly something that we need to partner on across the health sector providers and industry and, you know, across governments. So I hope that provides you a bit of an answer. It's not going to be as simple as the highest polluter pays.
I'm the medical director here in the Spiešťanisba. And as it has been already mentioned, we have had a lot of antigen testing here, as well as the vaccination center. So the pandemic in general has produced a lot of plastic waste, but enormous amount of plastic waste on the personal equipment, which protective equipment, not only gloves. This is also masks. This is also all the overalls we were wearing and the little sticks. We really served tens or hundreds of thousands of these, and we have been really producing everywhere, all over Slovakia, all over the world. A lot of additional plastic waste, not even mentioning the to-go stuff and etc. etc. Not everybody could adopt immediately to the biodegradable packaging, but definitely the personal equipment, which the protective equipment, masks, gloves, and everything, which is compulsory to be used to protect the person who is the healthcare professional. So what's your opinion on that, especially if NHS has taken this kind of a step? And you mentioned the inhalation gases, you mentioned the little inhalators, etc., etc. But there is a huge amount of, also in the ICUs, the caretakers are using these protective overalls. There is a lot of plastic tubes to deliver oxygen to the critically ill people, etc., etc. How this is going to be tackled, or how healthcare without harm or NHS will be tackling this? I would like to know a little bit more of this. I know technologies. When do we develop a technology for an overall which is biodegradable? I don't know. So these kind of things, how do you see this and the perspective of this? Thank you.
Thank you very much. I do think that the question that you raise is a reason why so many healthcare professionals are deeply concerned about the health system being sustainable, because of the amount of plastic that's been seen. And just as an aside, plastic is very high carbon because it's derived from fossil fuels, you know, so it is a product that we need to do something about. And we've all been caught short by the pandemic, even if you know, in hindsight we feel that we could have done better in many instances. diseases. But I agree with you entirely. There is, at the moment, we are on an unsustainable path. And in fact, from the work that we've done at Healthcare Without Harm, we know that if we don't do something about it, our carbon emissions will treble by 2050. So, and that's not just because we might be using more products, but just because of demographics and increasing diseases. So the need to do something about it, it's absolutely huge. I would like to suggest that in terms of protective equipment, we should be putting calls out to industry for better types of products, either because they are biodegradable or recyclable, or that they're reusable by design. We do not need to have throwaway things for everything. It's just that that is what's available at the moment. And I know in the UK, there was a call put out, particularly for masks, for instance, to try and understand, could we have some reusable by design kind of masks? Could industries like Burberry help out with this kind of thing? You know, there is the floor is open for innovation and finding new ways of doing things. I'll just give you an example because you raised the one about the sort of the uniforms. In Poland, they did a call out to industry for their staff uniforms, wanting something that was going to be sustainable, low carbon, low water use, that was going to be comfortable for staff, retain moisture levels, that was reusable, and so on. So they actually put a call out with what they would like, without it being too restrictive, but a real vision of what they would like for their uniforms. And they found a local supplier who has designed staff uniforms made out of bamboo. And they feel that they've achieved a win-win-win on all those criteria. So I think we need to be bold and really reach out for some innovation. Is difficult because in the meantime, we still need to use what is available. But those of you that are in the industry and want to make a call for something different, this is the time to do it. And what we call a forward procurement approach, which is where you might say to industry, we're looking for a product that will do this and this. We've had this in the NHS, for instance, where we've said we would like sustainable lighting in hospital that's also good for the doctors who are looking after the patients and good for the patients. And we came up with a solution that was completely different to what we might have had if we had just said we wanted you know, new lighting on the ward in a very you know, specified way. So for me, that's one of the futures, and that feels that fits perfectly with why you're all here today, is to try and look at the possibility of what products might be able to be used in healthcare in the future. And you're right, we have got, you know, there are so many areas where we need to work on if we want to get to zero carbon. You know, my plea to you all is to get started now. I think the other one is how we manage waste. So when we haven't got things that are reusable by design, managing the waste products is very important. And there are ways that are more sustainable than others. And that is dependent country by country, but I think it's worth looking at in greater detail as well. So I hope that helps. But yes, we've got a big mountain to climb together.
Yeah, thank you very much for your opinion and how to tackle this.
Thank you very much, Sonia. It was lovely. We all know, I think, that it's impossible. Sometimes it sounds like an impossible task, but I'm sure that together we can achieve it. Thank you very much for your time. It was lovely to see you and hear from you today. Thank you.
Thank you very much.
Goodbye. Now I would like to invite Mr. Martin Pavelka, who will introduce the COVID automat.
Thank you so much. I'll start with the story, a genesis of the COVID automat. It started as a COVID semaphore at the Bratislava Magistrate, which I created following a request from the Magistrate. They said, well, Martin, you know, the first wave was quite hectic. We were kind of struggling and inviting everything on the knee, literally. We need some predictability. We need to know like roughly what to do at what stage of the epidemic. So I thought, oh, let's create a semaphore that will put some predictability into an unpredictable epidemic. And I think this is the main objective of this tool, of this intervention tool. This was later adopted by the Slovak Republic and later renamed as COVID automat, and now we have the fourth novelization. Epidemics by nature are extremely unpredictable, so there's at least some element of helping the industry to sort of predict what sort of measures will be introduced at the various stage of the epidemic, at least prepare what is inevitable to come. We are very familiar with the British COVID automat, the alert system. These alert systems became very popular all across the world. Almost every country has had some variant of an alert system. And as shown here, even in the UK, for every level, you had a certain set of restrictions. You could plan in advance. Okay, if we enter the peak of the second wave, third wave, we roughly know what to expect. Some examples from abroad. On the left side, you see the Berlin Corona Ampel, which is in the form of a traffic light, very iconic for Berlin. And based on reproduction number, incidence rate of new cases and hospitalizations, they come up with green, amber, or red color, which then tells you what restrictions will be imposed. And on the right side, our neighbor, the Czech Republic, it's a mnemonic anti-epidemic system in the Czech is dog. And for each color of the epidemic, the dog either smiles at you or he wants to bite you. What happened? Well, these kind of make sense, intrinsic sense in an environment where you don't have a vaccine. So the only way to protect yourself is basically to hide. And indeed, every higher stage of the alert system imposes restrictions so we can kind of hide. We work from home, we close restaurants, we impose restrictions such as curfew. Once you enter a vaccine environment, that's the ultimate solution, right? You are protected against the virus through the vaccine. So in the EU, these alert systems were slowly abandoned. And instead, what we came up with on the EU-wide level was kind of a vaccine passport, which is a contentious issue in the UK. We hear from the Johnson government they may return to the vaccine passport if Plan B is introduced. We don't know it, but in the EU, it's a kind of a ready-made deal. It works. So I think many of those worries we have in the UK are really just worries, and the evidence from the EU countries shows us it can be imposed. There is a bit of a, huff and puff in the first weeks, but ultimately the population kind of bites their tongue and they follow. So the EU-wide system of the vaccine passport is based on a sort of Germanic Austrian model of 3G. As they call it, vaccinated, recovered, and tested. In German is geimpft, genesen, getestet, hence the 3G. And if you follow any of those three, you basically get access to a restaurant, you get access to a gym, to a swimming pool, etc., etc. Well, the problem in Slovakia is we have some of the lowest vaccine uptakes in the European Union. I think we are the third from the bottom now. Only Bulgaria and Romania are worse than us. And we can go into whole discussion why it is so. We can't really abandon the COVID automat. Which really makes sense in a non-vaccine environment. So even though we have a vaccine, it's like we have a problem, like, well, we have a vaccine on the market, but people are not vaccinated. So unfortunately, we end up still with what I call Stone Age toolkits, Stone Age tools. Nevertheless, we still try to merge the EU-wide approach with this sort of Stone Age toolkit. And so we decided that for each segment of life. Here, just for illustration, I showed fitness, but the COVID automat covers basically all the facets of social life. Restaurants, hospitality, mass gatherings. So we decided that for each of the elements, we would actually split them trifurcate them. We would split them into the 3 different modus operandi. You have the basic level, no restrictions based on your immunization level. So you can be unvaccinated, you haven't recovered from COVID, you're not tested. Or you can choose as an organizer to follow the 3G, the German, vaccinated, recovered, tested, or you can choose a fully vaccinated level. Each of those 3 are all up to you as an organizer who organizes the event, and each of them have or attract the same risk level. They all end up in the same residual epidemiological risk, more or less. And they all have different set of restrictions. So if you follow the basic level, unfortunately, the residual risk is very high. So as we move up the risk levels, you'll be closing quite early on. So you're kind of forced to adopt the 3G level. But even that has a high residual risk going up and up the epidemic curve. So the fully vaccinated is basically the solution. That is the ultimate solution. I think UK is a very nice example that shows us the exit out of the epidemic is through vaccinating a population. Now, what you see on the top is the current, next week's, it's COVID automat. It will be published tomorrow. So you can see it with a day's advance. We were discussing it on Monday. So this is the solution, or this is the final version that we agreed on Monday. So with a day's advance notice, you know what the regions are going to look like tomorrow. And as you can see, the correlation with the vaccine coverage is so obvious. So again, it comes back to what I said on what the UK is showing us. The exit out of the epidemic is through vaccination. So highly, highly vaccinated regions, Bratislava and the surroundings, are in level 2, the amber level, whilst some of the lowest vaccinated counties, unfortunately, are being put into the highest black and dark red levels. Now, I, together with the Matej Mišik, who's the director of my institute, and Jan Mikas, who's the chief hygienist, together we sat down and I basically said, look, guys, in the UK, the population that's the most vulnerable, 50 plus age group, that's highly vaccinated, is basically protected. They can afford to abolish all the restrictions. It's okay if the young population is infected, they can produce new infections, but as long as the vulnerable population is protected, they will not result in hospitalizations and there will be no excess deaths. So as a result, there will be no social costs on the epidemic. Let's put a mechanism that will kind of mimic this UK approach. And as you can see, having studied at the London School of Hygiene and Tropical Medicine, I do kind of steal a lot of nice, bright British ideas and try to implement them into our COVID automat. So we decided to put an element that if you are highly vaccinated in the population 50 plus, you get what we call a golden ticket. So if you reach certain threshold, 65%, 75%, 85%, you can get 1, 2, or 3 golden tickets. And even though the mathematics of the code automat could show you are in the black level. So let's say a county AZ, let's imagine county AZ has a very high infection rate. Mathematically, they will be in the other level 3, the black level. If they have highly vaccinated, vulnerable population, they will get 1, 2, or 3 golden tickets, and they will be actually put into better risk category, because we don't care about the infections. What we care about is social cost of the excess mortality. And if that is not there, I don't need to put restrictions on that county. How many golden tickets do we have? Bratislava has 2 golden tickets, and Bratislava's surrounding has, all these counties have each 1 golden ticket. And we have these kind of surprises in the east of Slovakia, which is there's a very low vaccine coverage. Actually, Prešov has 1 golden ticket. So that's Žilina and the Ilava County. And this basically comes back to what I said, if you are highly vaccinated, it doesn't matter, your infection rate is very high. So here we are looking at the UK, which I use as a basket case all the time. The infection rate, very, very high. The third wave is on the rise. Reproduction number in the UK, 1.06. But look at the hospitalizations, fraction of we experienced back in the second wave, a fraction. COVID in the UK doesn't have a social cost anymore. It is on the par with flu. Vaccine has put it on the par with flu. So this is the exit out of the COVID epidemic. Now, some of you may recognize the font. It's from The Guardian. I'm not a Guardian reader, I actually read the Financial Times, but they have amazing iconographics, so I steal their iconographics quite often. Now, how effective is COVID automat? We use a mathematical model developed at the London School of Hygiene and Tropical Medicine, EpiNow2. One of the co-authors is Sebastian Funk, who's also a member of the SPIMO, which is an advisory group, modeling group to the UK government. And we use this mathematical model to estimate reproduction number in Slovakia. So what you see here is a timeline from August all the way till October, and the estimated value of the reproduction number. And this is basically the estimation curve, probabilistic. As the holidays ended and people are importing new cases from abroad, and the school year opened, so children are mixing together and basically then spreading the infections further into new families, we had a massive rise of the reproduction number. At the time, many counties were green. As the infections rose, we were switching the counties into red and dark red, and within half a month's time, the reproduction number fell from 1.5 to below 1.2. So this is the critical line 1. Just to remind ourselves, if it's above 1, we are rising. If you are below 1, we are decreasing. And the second line is 1.2, because if the reproduction number has 1.2, it's basically the equivalent of doubling every 2 weeks. We discover a dangerous stage we don't want to be in. So now we are below that critical line, 1.2. So we are at the moment, the reproduction number is 1.1. So we're doubling once a month. Not great, but here at 1.5, we're doubling every 5 to 6 days. So to see the R decreasing in the space of half a month by so much, I can tell you the COVID automat is an extremely effective measure. But how long can this effect last? And it's just my last slide before I bore you to death. Well, this is the problem. If we look at the mobility data from the second wave, so earlier this year, January to March, from earlier this year, you may remember we had some of the toughest restrictions. We had almost a complete lockdown, state of emergency for solid 4 months. But if you look at the mobility data, they tell you a very different story. They tell you basically after a while, people don't obey the rules. You can't lock people forever. You can lock them for 2-3 weeks. It's a very effective measure. But after the time, we are social beings at the end of the day. We want to go to pub. We want to go to the gym. We want to meet other people. So doesn't matter how much you try. Yes, initially, the mobility dropped to 50% of the pre-pandemic level, but it just rose. This dip here is when the government scared the people. They said we will be controlling and enforcing the rules. It never went to the 50% and it started rising again. So again, it's a very short, limited function. So COVID automat, very effective, but the exit of the epidemic is not the automat, it's the vaccination. And that's all from my side. So I'll take your questions.
Thank you very much, Martin. That was really interesting. So vaccination is the way. And now I would like to ask the panelists to please come to the podium because we are behind schedule a little bit. Mr. Konova, yes, please. Thank you very much again all for accepting our invitation. And without further ado, I would give the floor over to Martin Smetana. Thank you.
Thank you. as well. So my name is Martin, and well, I will be in charge of moderating this debate. And as you know, that we are slightly behind schedule, so we have roughly hour and 10 to 15 minutes left. And the topic that we are about to debate is massive. We could spend actually days discussing it. So we will focus probably on the most important bit, that what are actually the key lessons learned from the pandemics, and how can we actually utilize all these lessons learned and experience to make sure that we will overcome all the burden, all the unintended consequences of COVID in as little time as possible. Before we start, before I introduce all our esteemed guests, I would like to give thanks to Sonia for her presentation, because, well, zero climate emission measures and policies are also closely linked to actually, generally speaking, improving external environmental factors. And probably you do not know that Slovakia has, according to the OECD, roughly 7% of all deaths that can be attributed to environmental pollution. The average in the EU is 4%, which would, if you calculate it, it is roughly 1,500 preventable deaths in Slovakia. So it is a crucial topic also, which has to be a topic of the government and the Ministry of Health. I would also like to give thanks to Mr. Pavelka for his presentation, because you might recall a year ago when we didn't have a functioning COVID automat, it was massive chaos and mess. So I'm very grateful that he does this job, and actually he makes sure that we actually obey to the rules and the measures which are presented in the automat. So, and well, I've already talked about Martin, so you know him very well. He is known from the TV as well, but as you know, he is also a student from the London School of Hygiene and Tropical Medicine. So I don't think I need to introduce him in any further detail. And when it comes to remaining panelists, every single panelist prepared a brief video that summarizes the key, let's say, objectives of the companies and what's the values. So I will start with Mr. András Schuster, who is Cluster General Manager of Ensana Health Spa. Thank you very much for coming. And I believe that we have a brief video also from you. So if you can please play the video. Perfect, it was lovely, and we will in a minute get into the question if actually this video is still true even after the COVID pandemic, so if you have actually changed and expanded your services, but so we will get into it into a minute. I would also like to introduce Mr. Darren Wilson, who is General Manager of Roche Slovakia, who also prepared a nice video for you.
So it is clear that healthcare systems around the world need to adjust to the existing and emerging societal, economic, and health challenges. How is Roche responding to this ever-changing global environment?
Well, the challenges of healthcare systems today are often focused around sustainability, resilience, access to innovation, and a drive to continuously improve to achieve better patient outcomes. As a global, innovative healthcare company, we at Roche recognize our responsibility to contribute towards bettering healthcare systems and improving patient outcomes. And this is why we have shifted towards being a purpose-driven company, where we intend to deliver 2 to 3 times medical advances at half the cost to society by 2030. We also recognize that to be the best partner to the healthcare system, we also need to change our ways of working, so that we can take an active role as a partner to help co-create the solutions needed to advance the delivery of healthcare around the world.
And so how is this agile approach going to contribute to improving healthcare systems and patient outcomes?
Well, many of our healthcare systems and the companies that support them come from operational models that are hierarchical, command and control leadership, objective-driven management. And these systems have their purpose. However, we believe that to truly unlock the potential of our people, to foster and pursue ideas and innovations that truly meet the needs of patients and the health systems that we serve, then working in an agile way where our employees are purpose-driven, empowered, self-managed, and creatively focused on solving patients' needs is the magic formula that will help us to rapidly scale the delivery of quality and innovative healthcare in a sustainable way.
And if you watch this video 5 years from now, what would be the changes or improvements you would like to see to call this endeavor a success?
Well, if I watch this video 5 years from now, I would like to reflect specifically on the country of Slovakia. And here I could imagine that Roche Slovakia was a leading catalyst to help to establish a framework for the Slovak healthcare system that is well-functioning, modern, efficient, and most importantly, centered around the Slovak patients. And that our efforts to co-create and bring value into improving the patient journey in Slovakia creates the trust and collaboration needed to be a strategic partner to the government and healthcare society. And most importantly, what I truly hope to see is that the opportunity for Slovak patients to benefit from the latest innovations and technologies that will help to deliver better outcomes and lives saved. We at Roche truly believe that we can make a positive difference in countries like Slovakia, and we are fully dedicated to this mission.
Well, thank you, Darren. It's very encouraging to see that there are companies like Roche who are willing to dedicate time and energy to contributing to improve healthcare systems. And I wish you best of luck on your journey.
Thank you.
Perfect, thank you as well. And we will in a minute talk about the potential of positive impact that your company can make in Slovakia. And last but not least, Kuno Váher, Cluster Director, Central Europe of AstraZeneca, whose actually vaccine is one of the reasons we can meet today. I am vaccinated by AstraZeneca, who also has a video, if I'm not mistaken, as well as a brief presentation. So Kuno, your presentation, and then floor is yours for the presentation. You can sit or go to the table and present. It's up to you.
Yes, so thank you for giving the word. I will sit here if you don't mind, so it's not so official. So my name is Kuno Váher, and I have 2 slides actually to share with you. And this is very much connected with discussion we had earlier and previous presenters. So I believe this, and we all know, and we have seen a lot of analysis, a lot of discussions around the COVID vaccination rate and what kind of conclusions we can take from that. And we all know there are countries with very different vaccination level. And we can say that, yes, nice to know, but if you can go to the next slide. So it's important really to analyze why it is happening like that. So what is behind? And I have, I have worked in the Nordic countries, I have worked in the Baltic countries, and now in Central Europe. And there are few elements what I would like to highlight, and also based on different analysts who are analyzing the countries. And as was highlighted before, unfortunately, Slovakia is 3rd or 4th country from the bottom, and we see at the moment infection is up again in Romania. It goes up in Bulgaria, and it is very high, for example, in Latvia and some other countries. And key conclusions, and you can say if this is wrong, but what I see different analytics and what they are saying, and if you're going to the next slide, row by row, I try to so-called give some kind of key messages or key so-called conclusions, and please afterwards we can argue, if this is right or not and what we can do. Actually, yes, we have some factors. Vaccination is low, but we need to really think all together how we can change it. And what I see, if you take into account that, for example, Scandinavia is really high, and you see in Scandinavia at the same time, those anti-vaccination groups are really strong. But despite that, vaccination level is really, really, really high. And I could say that having been quite active in the Nordic countries and in Scandinavia, it's all about, we can say those three first ones. It's really people, a regular person is believing in life sciences. They have really strong life sciences area, and they believe in doctors. They believe on what they're saying. They believe, the healthcare. And this is a bit different what we see here. And this is the major difference, I could say. One element I want to highlight also, I'm responsible for Hungary and Slovakia and Czech Republic. If you see, just simple thing, walking on the street. If you are in Budapest now, I will be tomorrow, after tomorrow in Budapest, I was last week in the Budapest. You see everywhere is Professor Merkel, these slogans that, you need to vaccinate. And this is really prominent doctor in the society, everybody is trusting. You don't see this in most of the countries, but you see in our, CE countries, Hungary is #1 with vaccination level. There are other reasons also. They started a bit earlier, they used other vaccines, fine. But at the moment there is enough vaccines, but not vaccinations happening. So really, this is also the area where we all can join our forces. We can work with the doctors, we can work with those public relation experts who are helping to convey the message, to build up the overall campaigns really to seek vaccination. And again, I'm highlighting, it's not secure that vaccination is there. It secures that we can treat better oncology, we can treat better other diseases, and patients are really following their health. And health is like an investment, and to have that thinking process more in people's head, it helps everybody of us to improve the healthcare in the countries. So we can use this as an opportunity from that perspective, and this is really where all the pharma companies, all the hospitals, all the parties and embassies, etc., are very much ready to help in this. And of course, another, at the very end, what is the difference between maybe CE countries and for example, Scandinavian countries is overall political stability and transparent communication. I really like this communication earlier. It was so deemed clear. And if we can have more that kind of very clear facts, very clear messages, this needs to be in the media. And sometimes, and this is also Germany suffered, sometimes if you're sending scientists to the media, they need to be briefed. We need to really work with also these communication experts that what are the messages? This needs to be clear. And this has been clear in the Scandinavia. Very clear messages, very clear rules, and then people are following those. So that's my short, very short, from a bit different angle conclusion. So we are ready to help. Everybody is ready to contribute. Let's use this as an opportunity to increase overall society awareness, and also let's secure that healthcare is trusted by the patients, and this means also new medicines availability. That if really patient sees you get the treatment here in the country the same like it is in guidelines, the same like it is in Czech Republic or in Germany, then they trust. Then they vaccinate, then they follow the treatment, then they are following reason to improve the health outcomes of a single patient. So that's my very short conclusion. And also, if you're going to the last one slide, what I want to highlight, there are several initiatives ongoing, and one is this called out by London School of Economics, and AstraZeneca is also therein, and some other partners. those kind of activities now are organized in all the regions and also in CE region. And this is led by several think tanks from UK. And let's really try to benefit from that. Let's really see if there are good forums to learn from, to share the ideas. And this is really what to learn from this COVID crisis in wider scale. Thank you a lot.
Thank you as well. So, gentlemen, I have 3 topics for us to debate and a warm-up topic, a warm-up question. The warm-up one is focused on how actually has COVID impacted you, yourself, your businesses, and what are your key lessons learned from past year and a half. And I would like to start with Darren. Darren, if I'm not mistaken, you during the pandemics completely redesigned your offices, but it was not only about changing the furniture and design. If I'm not mistaken, you try to reshape the company. So can you tell us more about it? And also, why did you choose, the pandemics for this change?
Sure. So welcome everyone, and thank you for the opportunity to be here and actually have the chance to talk about healthcare and well-being during COVID. It's an incredibly important topic for all of us. I first like to maybe speak about what was one of the biggest challenges that we faced before even undertaking a company transformation. And that was the mental health and well-being that we had to deal with during COVID. I think that, for all of us as business leaders, this had us take a look at healthcare and really to look at it as human care and to really bring empathy back into how we were approaching our employees, our families, and our friends. We all went through one of the most traumatic moments in any generation. It was absolutely unprecedented. And I really believe this helped us to reframe the importance of mental health and the importance of healthcare in our societies. It's helped us to really understand that healthcare is a priority. It is a pillar of our society, and it requires the right focus and effort to put it in its rightful place for us. So I really congratulate also and appreciate the words of Ambassador Baker. Thank you for I really feel your honest intent to make a difference here in Slovakia. I share the same, and we need more people to bring this word forward. Now, in regards to Slovakia, so yes, as a traditional pharmaceutical company, our old model was to come into countries and to sell medicines and make profit. This was sort of a historical model of pharmaceuticals. It's one that also maybe in some cases gives us a bad reputation. But in all transparency, that's not who we are. That's not the value base that we bring, and we recognize this. So, during COVID, yes, we actually went through worldwide transformation as an organization. In Slovakia, we no longer have sales representatives. We no longer have anyone who is commissioned to sell products in Slovakia. We've repurposed our entire company under a common mission, and our mission is to help to improve the healthcare system in Slovakia so we can deliver better outcomes to more patients. And the people that we put out in the field, they're focused in 2 areas. One is to help to optimize the patient journey in order to ensure that we can bring better outcomes to the healthcare system. And the second one is to work on health systems, to be able to build partnerships and establish the right kind of ecosystems that are going to allow us to solve the critical challenges of today and pursue the opportunities of tomorrow. And this means bringing the private-public partnerships together. It means building the collaboration with governments, with institutions, health associations, startups, and industries like ours. We have a great example already, and so I'm happy to be sitting beside Kuno from AstraZeneca, because we have a great example from Poland, where they've just initiated the Warsaw Healthcare Innovation Hub. And this is a collaboration between the Polish government, EIT Health from the European Commission, AstraZeneca, Roche, and Microsoft. And it's a collaboration where they're all coming together to direct funding and efforts towards critical challenges within the society of Poland in order to help to better healthcare there. And these are the kind of opportunities that are available to Slovakia. So I'm really looking forward to seeing what we can do together collaboratively to make a difference here.
Perfect. Thank you very much. Kuno, because of the vaccine, I believe that you got in touch on extreme regular and intimate base with every single government in the EU, including Slovak ones. What are your, let's say, key lessons learned, or what would you change when it comes to the cooperation, the government? And also, have you considered the fact that you would actually set up a branch in Slovakia? Do you think it would make a difference to be here with your representatives directly in Bratislava, or it is something that still you think you can manage as a part of the Central Europe region?
Yes, thank you a lot. So one thing, if to talk about learnings from COVID, and not only in Slovakia, but in overall, I mean, in those countries where, for example, let's take UK, where, from start, private partners were included, they got the better results. So that's the one thing. So because no one was experienced with that crisis, and there is needed a lot of, more brains always brings the better results and more partners involved. And UK really did it great. In some countries, we also really proposed third parties, really public communication specialists, because always with that kind of crisis, there are scientists are taking the scientific part, there are doctors are taking this so-called like doctor view, politicians, but quite often they are missing this so-called public communication expert. And sorry for highlighting this too much, but it's this communication is the key here. You cannot, say, and as was very nicely showed, you can say that stay at home, but it's not nowadays environment where you are just, saying what you cannot do because people are just not following this. And the same with vaccination. You need to teach, you need to influence people. And that's one thing, many governments didn't succeed. Then another element, AstraZeneca presence in Slovakia, we are here. So we are building our presence in Slovakia. We have already, medical specialists, and very much like my colleague from Roche was highlighting, we are just trying to improve patient pathways. We are trying to improve really copy best examples from other countries, how the patients are followed, how the patients are really treated, not to have this so-called historical ways of working. So we are really dedicated, people are working, and maybe then that's why this is not so-called seen that we have, huge amount of people, but we have medical experts, we have, patient pathway experts who are really helping to get the best practices in one or another disease area around Europe, what we should implement in Slovakia, or at least we are proposing that. And of course, the medical society is free to choose. And another element is these partnerships. We have a strong R&D presence in AstraZeneca in Slovakia. Many patients, thousands of patients are benefiting from clinical trials already. And doctors can do the scientific work to secure that the new medicines are coming out, that this is tested also in Slovakia. And quite often those patients are in a segment of patients where there is no any other disease. So new treatments in the clinical trial is the only hope for those patients quite often. So we have strong presence, and we are bringing this more up.
Perfect. I'm very glad to hear that. Andreas, I read a study from the UK, from the NHS, and they've calculated that in order to deal with the backlog of patients, they would significantly need to expand the capacities in rehabilitation, spa services, and also funding. Have you already noted that there's a difference in terms of the patient's profile that are coming to your spa? Do you think, what are the trends that you expect when it comes to the patients? Do you think that you will have to expand your services or change some of the existing structure in order to better fit either the patients with post-COVID disease or the patients who didn't receive treatment in time and now have deteriorated health state?
Well, first of all, as the host of the event, I would like to welcome officially also Your Excellency, dear online visitors and listeners, and of course here the present ones. Thank you for the question. Unfortunately, I have to say the times, they were extremely challenging when COVID hit us. Within 6 months, within 6 weeks, the whole spa was empty. We were wiped out of clients just because of the fear. And I have learned something, and it has been mentioned several times before now. One of the key critical success factors or failure factors was actually the political communication that was put out there, being it testing, being it vaccination, being it prevention, being it how we are going to restart the economy. And we are struggling with this as a private entrepreneur, that sometimes we had 72 hours, even less information time to change overnight. Yeah, to find in an unprecedented way 5,000 respirators and trying to get protective equipment, not to breaking the law. We did our best, and I think to 99.9% we always achieved our goal. The challenge ahead now, what is happening with the patients? Do we see a rise in COVID patients? I can't really say in large numbers. Yes, we do. Yeah. We never had COVID before. So if you say, yes, we have 1,000% increase because there was zero before. But on the other hand, unfortunately, we see at the same time, due to cost restructuring or cost withholding from the insurances, a lack of really prescribing a lot of patients to come to the spa and to do recovery programs. We see this as a trend that has started a couple of years ago, actually accelerated now that we get less and less prescription patients from the state health insurance. That is not something that we are surprised at because Austria, Germany, other European, Western European countries have this, that there are less prescriptions. The spa might be, the treatment might be still okay, but whatever concerns the stay of the patient, of the client, comes more and more from the private pocket. So we will work also here on more intensive spas. We are little, not these big R&Ds, but we also do R&D on our spa island, because people like me, us, we are fully working. Yeah, it hurts after 50 here and there. You need to have some relief, but no way that we can take 3 weeks off. Yeah, so we have to work here together to find a way to have an intensive way of treating the patients and adapting to nowadays. And in this regard, I think it's also very important, and we haven't really spoken about environmental impact here, which I do think for us as a spa is one of the critical functionality. We are a health spa, we are a healthcare provider, and health means that we reduce our emissions, not only in the air, but also in the water, that we have a tremendous amount of light emission on the island during the night, you know. And I have at 5 o'clock in the morning, our peacock thinking it's daylight, hooray, and let's scream for the partner, you know. So we have different aspects, and every single one of them we are addressing at the moment, and it includes even the vehicles that we have. You know, this dinosaur of a street cleaner that just passed by needs a replacement, you know.
Perfect, thank you very much. Martin, I have a very quick question for you. You've presented COVID automat for, well, which is basically communicable disease. Can you imagine such a mechanism would be used by government for non-communicable diseases, for example, cancers? Let's say that if an incidence would pass certain threshold, a government would have to act, increase funding, increase, let's say, focus more personal resources on that particular topic. Can you imagine something like this be prepared and actually put in practice?
I can tell you already that for obesity, we will be flashing dark red, possibly black. As someone touched the topic very briefly during the introductions, the COVID pandemic, of course, accusation flashing into our eyes because humans notice change that is sudden. Humans overlook change that is incremental. And even if it reaches epidemic scales, because it's been incremental for decades, literally decades, we don't realize there's an acute epidemic of obesity. If you tackled school meals, if you started taxing salt, sugars, and changing people's habits, how much would you save on healthcare, cardiovascular diseases, cancer-related diseases? If you tax tobacco more, or actually, I am in a huge favor of the New Zealand approach, where they're raising slowly the age from which you can buy cigarettes every year by 1 year. So they are creating a generation of people who will never smoke. I mean, how amazing is that? How many lung cancers we would prevent? To go back to your original question and to address it technically, non-communicable diseases, the automat, it wouldn't work because the change is so slow. It will basically flash red for 10 years. But yeah, maybe the solution would be communicating to the government, like, look, you are wasting billions on things that are so easily preventable just by changing your lifestyle.
Yeah, perfect. Kuno, please.
So maybe it can work, between the countries, and there are some works done, to for example, cancer rates and also the survival rates between the countries. This can be so-called, the same thing, but a bit wider scale, not, on the country level. I believe that can be one option.
Yes, I think it could be done because clearly, theoretically, if we had a COVID automat on non-communicable diseases, even though if it were flashing red all the time, it would actually it could be used, as one of the tools to show the government, Minister of Finance, that we need to solve this problem. Otherwise, it will be still incremental and it will never be solved. That's actually probably that's something that we can all conclude on. Okay, this was the warm-up topic. Let's move on to the more let's say challenging areas. The first one is focused on basically relationship with the government, and the question is, what, gentlemen, as representatives of an industry, can you actually, do you think that you can, what are the opportunities, what are the tools that you think you can help the government to deal with the backlog of operations, to deal with the probably upcoming pandemics of non-communicable diseases? What do you think your company can do, and how can you help, and what would you need to change from the perspective of the way how the government, the ministry works in order to make that happen? Darren, please.
Okay, it's a great question. I think there's a common theme that we're talking about is collaboration. So collaboration is actually one of the key learnings that we got from COVID. It was unprecedented to break down barriers between competitors in pharma. As an example, Pfizer, Novartis collaborating to bring vaccines out, even Roche collaborating with Samsung. But it was also incredible to show us the importance of private-public partnerships. And these are learnings that we definitely need to bring into Slovakia. It was mentioned already, the issues around communication. There's still a lot of bubble talk, and there's not a lot of talk where we're getting key stakeholders around the table for open dialogue, putting the fish on the table, actually talking about the issues and being action oriented to what it is that we need to do to really take on these challenges that are in front of us. I really think that communication is the key, the first before anything else. And it needs to be communication, as I said, with all parties at the table. So I was encouraged to hear the ambassador talking about bringing people out to your residence to talk on healthcare. These talks need to continue. We need to get the message on the table. So I think first and foremost, that's absolutely incredible. We also have to realize that getting through COVID, we are getting through COVID. So we're making a lot of positive gains, but we cannot go back to pre-COVID ways of doing things. This is a moment for us to take a pivotal change of healthcare reform. It's an opportunity for us to capture. And this is where we can really say, how do we build a sustainable, well-funded healthcare system that, as you heard in my video, is well-functioning, it's modern, it's efficient, and most importantly, it's centered around the patient. Patient centricity in Slovakia needs to happen. It's not where it needs to be. It's not where it is versus other countries. Slovakia suffers a lot of inequality of care, and particularly we talk on cancer. So COVID actually had a dramatic impact for cancer patients. It reduced the number of patients showing up to physicians for diagnosis by about 15% across Europe. At the same time, cancer incidence is increasing. The challenge for Slovakia, though, is that if you live in Slovakia, you have the highest chance of dying of cancer than if you live in any other European country. And this is a sobering fact that we need to put attention towards. We have a cancer pandemic and we need to be upfront and address it. It's the second leading cause of death, but to your point, it's not in the politics yet. COVID's in the politics. Cancer is not in the politics. It's in the politics at the EU level. They're introducing the EU Beating Cancer Plan. This is really to give the strategic framework for countries like Slovakia to mobilize and put in the appropriate measures to address cancer within the country and to collaborate with other countries. But then we need Slovakia to participate at the national level in these EU initiatives. And we're not hearing it or seeing it to the extent that it needs to happen. And so I just wanted to kind of champion this a little bit. It's Breast Cancer Awareness Month, so I think we should be putting attention on this topic. It needs a lot more stronger voice from all of us in the community and also as us as business leaders.
Thank you. Martin, you have a response?
You ask amazingly good questions, Martin. And the problem with good question is I have to sometimes think about them to come with a good answer. Now, having heard you as well, I think the solution wouldn't be automat for non-communicable diseases, but a KPIs. Have a set of KPIs for obesity, for cancer, for addictions, for mental health. I'm a huge favor of the Hong Kong approach. I think politicians should earn 6-digit salaries. I think they should be rewarded their bonuses massively on how they perform. And if we see KPIs for cancer going down, going south, they shouldn't be getting any bonuses, and their salaries should be cut accordingly, just like it is in the corporate sphere.
Yes, that's a very, I would say, a correct and very ambitious approach. Kuna, you wanted a response?
Yeah. I wanted to few comments only, very short. So-called adding, I fully agree with what was said by both of you. So the thing is, Slovakia is not, not the biggest country in the world. There is a lot of good stuff happening in other countries. So, more this learning and stealing with pride, let's say. And that's, one of the things what we can offer really, because we have the, all the globe coverage and we see good examples, and not us to share this, but we can connect the people and to see, okay, guys, there is the issue, and we know that in this and this countries are potential solutions. So that's one of the elements. Another element where Slovakia is really now improving, if you want to have really efficient some kind of system, you need the data. You need to, all the data is digital and you can analyze. Otherwise, it's very difficult to improve, because healthcare itself is the most sophisticated area to manage. And this is the way government needs to invest. And the third point, the last one I have, there is no excuses. We all need to sit in the room and to see and to really discuss how it is possible to have basically 10 times more medicines available in oncology in the country where the GDP is lower than in Slovakia. The same CE countries, Slovakia, based on GDP, should have completely different view. We as a pharma can say that our negotiation power, I have the same in Hungary, in Czech Republic, in Estonia, in Latvia, or in Poland. But in those countries, many countries GDP is lower and there is significantly more available. So that means something is wrong in this collaboration. So we need to really sit down in the same room and to find the solutions and learn from others.
Yes, completely agreed. Andreas, I have a very specific question for you in this topic. Is that I remember it was in spring last year when the government announced that all patients with severe case of COVID can go for free of charge to a spa treatment. But from what you said, I understood that the health insurance companies did not reflect on the promise of the government. Is that correct?
That is correct, yes. Okay. At least with us it is happening. I can only speak for two spas in Slovakia, that is Merdaki and here in Piešťany. I have an insight what happens to some of our competition, because we are also member of the Spa Association, and we are exchanging some critical trends here, but it is reflected in most of our spas in Slovakia, yes.
Okay, so then probably it leads to, one point that all of you touched, that theoretically it would be a good idea if a Ministry of Health or government appointed a person, probably an ambassador, who would be a contact point for all of you in order to make sure that all the backlogs, all the issues that are consequences of a COVID would be solved. A person who would be in charge of the execution of the fact that the health insurance companies didn't raise the budget as they promised, the fact that you need to talk to them and you need a person who will make sure that everything is arranged, etc. Is that correct conclusion of this bit? Or
Slovakia is the 7th country I've lived in. I've lived around the world and worked with healthcare systems around the world. It's the only country where we have difficulty to get at the table to talk about the key issues. It's the only country. I can talk about it in Thailand and Indonesia and Switzerland and Belgium and Canada and the United States as a contributing partner to the healthcare system. It's not happening here, not yet at least. This is definitely needs to happen. Philosophically, it's sort of like two worlds colliding rather than two worlds cooperating. And I really don't understand it at this day and age of where we're at and the challenges that we're facing. So my encouragement is that we need to open the doors and we need to have the talks. And it doesn't have to be one person. It just the philosophy of engagement needs to happen. It doesn't take that we don't need a coordinator. We just need that when we raise issues to the Ministry of Health that we're invited in to have the talks. Or when we have issues where we can have trilateral conversations between health insurance companies, the Ministry of Health and Pharma to figure out how we can get solutions to patients, right? And to do the best thing in the interests of the country. But in the absence of that happening, that's the issue, right? And it needs to start there. If it starts anywhere, it starts there. The solutions will come from this.
Yes, understood. Thank you. Andreas, please.
In this regards, we were also intensively speaking to the Ministry of Health, etc. I don't think that the one-person solution is the right way. I think the whole thing, coming from Austria, also worked in 14 different countries, that you have to start education maybe in school. It was mentioned before. Let's start with a healthier meal. We have looked here at the local hospital also in order to supply food to them. With the available budget, you never ever can provide a sustainable food with vitamins and supporting the healing of the patients. Yeah? So I think the fundamental change will only come if we have in the decision-making positions in the politics people who are open to this change, who have experienced it, who have seen different aspects, what is done and what has happened in other countries. So I do think it is a process. I do think with people like you, we may be on the right track to this innovation, you know. And only if these people come up there, then it's better. It's something that I criticize my families in Hungary in the education. If there are 65-year-old people trying to decide what the 15-year-old has to learn, he can't even or she can't even use the computer by herself. So the education will be reflected somehow there. And I think this new generation that is grown from the politics, from the people who have traveled, will help us. And I think the trial, the communication panels will also support this development very quickly.
Perfect, thank you. So in a brief summary, you don't need one person, you need a ministry that is open to debate, a ministry that regards you as partners, which I believe that current minister and his team is trying to do, is trying to communicate. So yes, perfect. So
change are coming.
Yes, perfect. So we can move to another topic, which is very popular when it comes to these days and the policies of most of the ministries, which is digital solutions in Slovak healthcare. Digitalization is often seen and regarded as a panacea to most of the healthcare problems. We know that e-health can solve plenty of issues in terms of ineffective care. But the question is, if you yourself as a representative of your company have some specific solutions or ideas, what would need to change in order for us as a healthcare sector can utilize the opportunities that digitalization present? And Darren, please, can you start?
Sure. So I'm going to talk a little bit about digital from a health data perspective. So digital and health data is actually the future for us, particularly in healthcare. And countries like Slovakia need a national health data strategy. We do need to have a plan of action about how we're going to modernize the system, not just in infrastructure, which the resilience and recovery funds are looking to address, but also in the process and methodology of data capture, data utility, and also the changes in the legislation around secondary use of data. We want to be able to ensure that countries like Slovakia is equipped so that they can use real-world evidence in a timely fashion, and that this evidence is of clinical quality to answer critical questions. And this will also substantially benefit sustainability in countries like Slovakia, because we'll be able to track outcomes associated to spend and be able to understand with transparency the spending efficiencies, and to ensure that we're making the best choices for the society. For companies like Roche and also AstraZeneca and others, we're very much focused and committed towards supporting at a policy level the plans of actions to put health data strategies into place. We've worked closely with Romania, embedded with the government to put their policies in place leading towards personalized healthcare. In Croatia, we've helped to build their genomic databases so they can capture data differently for patients. In Slovakia, we've also working on an MS Digital Registry, which we are collaborating with the Ministry of Health on to give a framework on how to better capture data. This is a huge opportunity for Slovakia. And just so we know, the oncology database out of Slovakia, the last release was 2012. This is, again, absolutely unacceptable for any modern society to be sitting in this position with a lack of understanding of where data is. I know I'm speaking strongly, but these are hard facts that we need to put on the table and address. So it would be great if we had a cancer, comment, but we need to do better around data management in this area.
Okay, Kuno wanted to respond, then Martin.
Yeah.
I'm very glad you mentioned this. This is exactly what I encountered when I moved back from the UK to Slovakia. We have data. It comes in amazing quality, amazing granulation, but we don't do anything with it. We sit on it. We sit on its golden nuggets and we protect them. The Public Health Slovakia had amazing data on COVID. I wanted to do many articles, like I wanted to do research and publish the articles. I was forbidden because God forbid the data to leave the database and be shared with the world. I don't know whether it's a matter of the post-communist mentality or what those people are scared of, but amazing data, it will never see the light of the world.
And maybe though very nicely to connect that, I believe we are sometimes in this digitalization, because I agree everything what was said. What we are missing sometimes, we are missing understanding, what is this ultimate aim of this digitalization and data analysis. And the ultimate aim, we had, I'm part of one, pan-European this digitalization forum where, tons of experts are in. And we formulated this in the way that the aim is, this is patient-specific treatment. That's the end of the aim. That's the aim. And this is the only way how to secure healthcare systems are sustainable. And we can take, super simple example, and this is nothing extraordinary. Let's take type 2 diabetes patient. Some you need to see every month, doctor. Some only nurse can manage. Some you need to see only once a year, based on the data, how the patient is moving, how stable the glucose level is, how the weight is going, how the concomitant diseases. And this is the way how healthcare system can survive. You are spreading the so-called attention and resources based on need per patient. You can do this only when you have the data. And that's as simple as it is. The same in oncology, it's the same everywhere. And everybody needs to understand this aspect. And then, why we are doing analysis. And again, I agree, we can have tons of data. If you're not doing anything with that, it's useless. And here, another term I want to say, or aspect, it's all about country competitiveness. If we are not as an environment using data in healthcare, but also in other areas, we are not competitive. And other countries are going far away, and also all the investments, I can say these clinical trials, for example, and R&D investments are going to the countries where you basically can click the computer and say, okay, with that disease, there is so many patients and you can study this drug in this country, versus in other country where you need to go into months or even years to understand how many patients, how many doctors are ready to go into this clinical trial, and those countries are out. And this is sector by sector in automotive, etc., in other areas also.
Darren, you wanted to make a comment?
Well, you're getting me going, so it gets my passion going in this area. So I'm not going to apologize. I think these things always need to said. In essence, yeah, and I just want to build what Kuno said. Slovakia is missing out, and as other countries right now are investing in this area and accelerating their healthcare spend to GDP. Czechia now 10%. They're engaging in a lot of these tools, these policy tools from the EU that's available to us. So in this particular case, we have the European Health Data Space. We need to see Slovakia's participation here. We can't have it that there's no voice from Slovakia on critical decisions that are really redesigning what the future data lakes are going to be for European citizens, and how we're moving towards interoperable data sharing as the way of our society is going to be. And this was going to help around dealing with rare diseases where we're not able to do clinical trials, and we need real life data to anticipate the incidence and impact of treatment. But we can't have Slovakia sitting on the sidelines. I mean, if we want to build Slovakia for better, for prosperity, if we want to achieve the goals and promise of this nation, we need participation now. And this is really critical.
Yes, completely agreed. And so the question is, well, yes, we, as Martin said, we have amazing data which we can't use. That's unfortunately the truth. We are collecting data beginning in 2013, but we just can't use it, unfortunately. But health insurance companies, they have data and then can use it. So the question is, why the health insurance companies are not more interested in value-based procurement or individual treatment plans? Do you think it is because of the way how the budgeting works, that they are focused on short-term results and not in value proposition and value deals? Or why do you think that it is the case?
So I think it's first best that the insurance companies talk on this, but in all fairness, the situation in Slovakia is not easy for the insurance companies. I do see a willingness for them. They're also Slovaks. They want to do the best for their citizens, but Slovakia has a funding issue, a substantial funding issue in healthcare, and insurance companies get rigid caps that give them no flexibility. And so when we're negotiating with them, we're just walking in, first step through the door, it's a deep discount. And if you can't do that, despite even having the lowest prices of Europe, you're just not going to get your innovation available to Slovaks. And this is not a sustainable system, and it's not a system within the best interests of the society at all. So I think there's an opportunity here also with the insurance companies, with pharma and the government. I do think we need to be around the table. We need to be talking about this and resolve the budgetary factor. If we take a look at cancer in Slovakia, I think it's about 36 euro per patient per capita in cancer spend. If you go to Slovenia, another small country, it's 67. Slovakia is the only country with a 7% 3-year compound annual growth rate in cancer spend. Every other country around us is 15% to 20%. I mean, it's absolutely clear that some of the solutions too is just the spending priorities, how we're putting money into the system and what's important. What Slovakia is the best at is using medicine for treating diseases like cancer that are old and outdated and not standard of care. There, Slovakia has the highest spend versus comparable countries like Czechia. But that is not what's improving outcomes, because I think that's the point here. We want to give productivity back to society. If you can just reduce the number of days that a Slovak spends taking care of a loved one because they're sick or because they're sick themselves, it's an average of 14 days in the healthcare system. Just reducing that by 10% is 0.5% contribution back to the GDP. So, if we do rethink, we just need to rethink here. If we rethink healthcare, we can make a positive difference and turn this country forward where healthcare, education, and investment becomes the magic formula for a prosperous and strong nation. And I do firmly believe in this. It's in front of us, but we need to act on it.
Perfect. Thank you. You wanted to reply?
Yeah, I completely agree with this piece. And another piece is more specific to answer the question also, even more specifically is if you are paying for units, you will get units. If you're paying, for outcomes, then you will get outcomes. For outcomes, measuring the outcomes, you need a system there in place and, quite a lot of brain power behind. And I believe also this good is the mix. I see, I have seen in different countries and discussed a lot with the experts in different countries. I believe it's a mix. It depends on disease. It needs to be a bit also motivating to do something with the patient, but outcome elements should be always there. So it's maybe but resourcing in the system is just inadequate. And again, I'm highlighting, we cannot compare. We are not saying that we need to be on the same level like Germany, but we should be on the same level with similar GDP countries. And we are far behind in Slovakia. And that's the key issue, I could say.
Yes.
So just if we're going to be on the same level of Germany, we need another 200 million just for oncology alone. If we want to be on the same level as Czechia, we need just under 40 million to be on the same level as Czechia. And that's within reach. That's within reach for the country. So we could resolve a lot of the inequality by just making these decisions. It's there. And I think also to the point, if Slovakia was just to even help benchmark itself towards surrounding countries focusing on inequality, there's no reason why you in Slovakia should be limited on your access to quality medicines that other Europeans around you are getting. There's no reason for that. And we work in the industry as mentioned, so we know our price points, we know what other countries are getting, and we're here really to make sure our medicine gets into the system, but it's not getting into the system. And the reasons why they're getting rejected recently is Article 90, not enough budget.
Yes, unfortunately, that's the case. But unfortunately, I have to agree with that. And it is also true that the budget for next year doesn't look that positive either. Andreas, even though we discussed digitalization from the perspective of data and the way how we can tailor the treatment for particular individual patients, from the perspective of spa services and rehabilitation, does not digital solution present a threat to your business? Because I remember that some of the COVID patients were recommended to use mobile applications to do home treatment, home breathing practices. Do you regard this as a threat or as an opportunity to your business?
It is clearly for us an opportunity. We don't see this at all as a threat. It's a natural development. It's a development like we went from a normal stand-home telephone to a mobile device. We can't stop it, and we definitely are investing in it. We definitely try what I mentioned before was an intensive care here for a week or 10 days, and then with a mobile app or with the digitalized surveillance of the reports that is coming in from the patient to guide him to better health. We are here a little bit in a competitive set, because my competition, yes, is direct pills and direct injection. We are using mud that we are preparing ourselves here. It's a 1-year process in order to get the mud into such a state that we can actually apply it to our patients. And that is a couple of 100 years old. Would you discount this and replace it with a pure digital way? You can't. We have tried to massage a patient digitally. It didn't work. So there are some historic traditional ways that, thanks God, are still needed. If you try to repair your car digitally, you are left without tires because it will not blow up itself.
Yes, that's true. I tried to fix my car yesterday, and I had to take it to the garage immediately after I tried. So it didn't work at all. And I was using an online tool how to do it on YouTube. Well, perfect then. So we can move to the last topic of the debate, and we have 10 minutes left, and then maybe 1 or 2 questions from the audience. And the question is focused on Slovak recovery plan. We were allocated roughly 1.5 billion. Roughly 1 billion is going to be spent on capital infrastructure in hospitals, new and renovated hospitals. Roughly 200 million euros should be spent on social care, long-term care, home care, and roughly 100 million euros is dedicated to mental treatment and mental care. I have several questions for you. The first question is if you think that the allocation of the funds is, let's say, correct, or you would say that your priorities would be different if you had a choice to decide. And then also some argue that these resources are going to do more harm than benefit because we didn't deserve them, and that's why we won't value them. I know this is a bit controversial question, but I would be very happy to hear your thoughts about it. And let's start with Kuno.
Yeah. I mean, I mean, if this was decision to allocate the resources, it's okay. So, but you know, what I want to highlight, for example, a lot of discussion in many countries is, and this is sometimes in overall investment is out, and we discussed here, and we all agreed. I understood that it's all about people who are leading this old area, and what is quite often, missed out is quality of people leading the healthcare. Is it hospital lead? Is it health insurance fund leads? And we really need to have different type of people. I can say one example, and hopefully someone is not channeling this back to Estonia. I saw a remarkable difference if the health insurance fund leader, and this was like one health insurance fund per country, was one official from Ministry of Finance. Many years it was like that. Health insurance fund was led by Minister of Finance, one in the department lead. And then next 6 years, the lead was regional Microsoft, the previous regional Microsoft head. And this was like a day and night. I mean, the quality, the effectiveness, the KPIs, what was discussed for the people, for the hospitals, for the system, for the diseases. And it's really quality of people. That's my comment here, where we need to invest. Quite often it's behind that. If I'm comparing the countries where it's better organized healthcare or not so good.
Perfect, thank you. Darren?
Sure, I'll just build on that. Actually, when you reflect on Slovakia versus a lot of Central European countries, many countries were in no different position than Slovakia was about 5 years ago. But it was actually, to your point, a lot of leadership in these countries that sparked the movement to really make the fundamental changes and reform, and not to do it in an incremental way, but to do it in a bold way. And I really believe that's what's in front of Slovakia at this moment of time, and the leadership. And I know we have an outstanding new state secretary. There's he gets it, which is great, but he needs our support as well, because he has a big job in front of him, and we have to make sure that the resources go in the right way. In terms of the spending, I think again, it's hard to criticize in the absence of a vision and strategy for healthcare in Slovakia. The last time there was a strategy published, I think, was in 2013. So I think there's an opportunity here to have clarity of action about where are we going and what are we trying to achieve, and to put down the framework that can survive political cycles. The biggest challenge with Slovakia in trying to do the reforms is, I don't know, you've had 30 health ministers in the last 10 years or some kind of remarkable number.
Average is maximum 2 years.
Yeah, maximum 2 years.
Average shelf life of a minister of healthcare is 2 years.
Yeah, yeah. But this is.
The last one who was serving 4 years was Mr. Zayas.
Yeah, so that's something that we have to acknowledge, is that this country is not disappearing. It's not a flash in the moment country. It needs a vision, and we need a vision to be protected by the political cycle. Healthcare is so political in this country. So if we're not going to, if at this moment, if we can come together, put politics aside, build the framework for where this country is going, build the strategy around healthcare, then yes, maybe those spendings are justified, but more importantly, they'll be overseen and accountable and properly directed to ensure that they are outcome oriented and serve the needs that they're intended for.
Perfect, thank you. Andreas?
This recovery fund for us is a little bit a hole in the wall. We try to, as a SPAS itself, we fall somewhere in the middle. Some see us, okay, you're hospitality. The others see us, oh, you're medical, but you are not manufacturing. We have a couple of advisors trying to find a way to get funding for. We have massive 7,000 square meter flat roofs to put solar panels. to isolate the facades properly, you know. And wherever we go, it's like, oh, but you're not manufacturing. I said, yeah, I'm manufacturing my mud, yeah, but this is only 3% of the capacity. So we hope that when the final details come out of where this funding is going, that something is channeled, and I'm not talking for us as SPA, I'm talking for the whole association, is coming into our direction as well, because at the end, we have massive amount of buildings. Most of us were built in the 70s, you know. Some we have already properly isolated. We have built now one of the biggest heat recovery plants using the excess thermal water running out from our bathtubs to preheat the heatings, etc. So there is a lot of possibilities, education, etc. You know, and one of our key factors, we all know it, is the shortage of staff, especially in healthcare. You know, that is one of our biggest factors. But you cross 120 kilometers across the border in Austria, there are thousands of Slovaks working there in the healthcare system. So lure them back, get them here with proper funding. It is possible, I'm sure.
Yes, understood. Perfect. Thank you, Martin. So if I summarize the points of gentlemen, the funds would be appropriate, but we need to make sure that we have a vision, plan, and leaders who will be able to implement them. My question is, do you think that we have leaders in our healthcare sectors? And as a member of, you work for Institute for Health Analysis, right? So I believe that you have information if the ministry is working on some strategic paper, a vision, something that you would like to achieve. So are you working on a vision, and how do you think that that the recovery plan will go if we have sufficient leaders, if we have a stability to make sure that the plans will actually be implemented? What's your opinion?
In my honest opinion, I think it will follow the same pathway as any funds from the European Union. It will just get lost somewhere. That's just my guess. If I had to put tokens on the roulette, I will be putting them on that number, lost.
Thank you for honesty.
The problem I found here, and let's go to the Institute of Health Data Analysis. A lot of the work that I do, or my colleagues do, in the UK would do an institute of 100 people. There will be dozens and dozens of mathematical modelers who would cooperate and create, you know, a model of the third wave and another model of third wave. And the government will have 7 or 10 to choose from to find, you know, this is the average. Because each model inherently is a wrong model, but the average of the model somehow kind of hits where the actual numbers. There is no one else to do models. It's just our model. And even that has limitations because there's only one person creating the model. So where is your peer review? And this goes on for other ministries or other aspects of our ministry, or even within the Ministry of Healthcare, other divisions, or Public Health Slovakia. It's you would have hundreds of people do the job that here only one person can do. And that's why you get these strategic plans from 2013, because so we have the people to write them, but then for the next 10 years they have to be put on some other task because you know that's why there is no continuity, and then the people burn out. I think this is the case of our director Maciej Misik. I think he burned out to a degree as well, because he should have a team of 5 other people supporting him, but he's doing it on his own. I think you as well, like you were leading our institute in the past. You felt it as well. It's the workload is unbearable.
Okay, so that means that one of the biggest obstacles that prevents from efficient use of the resources is the fact that ministry is understaffed, and ministry can't cope with the amount of work, which means that some of the work is just overlooked, and that's why it's so random. That's why the past funds were also not always efficiently spent, and you think and you are afraid that this is going to happen as well, right?
Or then you have a second aspect of it where just the turnaround causes lack of continuity. Then you have people with amazing ideas, and it's good to have new ideas and fresh ideas, but if you don't have continuity, then it's like you're always moving in a different direction. I think so. I think it was you who mentioned it. It's yes, the change is hard. We're going to be the water falling on a stone. You will see the change in a year's time, maybe not in 2 years' time, but eventually the stone will get formed. I think that's a very, very nice parable that I'm going to be now using all the time. So if you don't have the continuity, the stone will never be shaped. Unfortunately, we are in a system that is heritage, this legacy of the old communism times. The change is needed to be massive, and hence the water has to be falling on a stone continuously for years and years and years.
Yes. Well, gentlemen, thank you very much. We have floor, maybe time for a couple of questions, but I'll just summarize the key points because you just summarized it nicely. Because the common topics that you discussed was the stability, predictability, value creation, leadership, and I believe that these topics are the things these are the values that that connects all of you as a panelist, and I believe that these are the values that the Minister of Health should be pursuing, and I really believe that the new minister is going to stay there for more than 2 years because that's actually the cornerstone of these values. So thank you once again, and we have floor for 1 or 2 questions. Yes.
Gentlemen, am I heard? Gentlemen, thank you very much for your very honest and very variable panel. It was really triggering a lot of ideas in my head, because I experienced all of the environments, because I worked as a doctor, I worked in an incorporation, global incorporation, not pharma, but medical devices. I worked together with Martin during his times in the Ministry of Health. I work now here in the with our general manager in the executive team. And I also thank you, Martin, for his first time understandable COVID automat presentation. And in the format, I think it should be presented properly, publicly, by an expert to the public with words I think everybody could understand here, and that we have also golden tokens, which is very important for the people to have a perspective. That means we can be better if we do this. Not only doing, we stop, as we have seen on the trafficking thing, that everybody stopped for a while because they were scared, but then they did not give them something, because you cannot control 5 million people. And also the armed forces are tired of this. This is not their job to control every time. It is prevention. And it should be prevented by these kind of well-addressed and well-described measures, okay? So this is also helping the business, our business, your business. And what I would like to definitely highlight from Kuno's presentation, from the points he has mentioned there is, I am also here in the spot. I'm a big fan of evidence-based medicine, because we want to really show the efficacy, I mean, on an evidence-based efficacy of our treatment, which is the, let's call it, Western kind of medicine with the natural healing resources, which do work. Trust me, they do work. And last is the political stability. So that means we have here, unfortunately, the shelf life of a Ministry of Health is 2 years. There is no sustainability. We have young people. We have a huge turnover of people who are coming there unexperienced. And with the latest government, with the latest from the top to the bottom, they lost all the historical memory. So there is nobody who can really make a proper continuity in doing proper programs like you mentioned. And also Martin has built together with Ministry Kalavska for the prevention of rectal cancer and for the prevention of the breast cancer, as well for the uterus cervix cancer. Do you hear about these? Not anymore. They were announced once, twice, and done. So that's the problem, the communication. I fully agree with you, and there is no political, unfortunately, no political will to sit around the table, a round table, so where everybody is equal and everybody can do this, because just simply there is no will, and therefore there is no project, and therefore there is no continuity. And if after 4 years everything changes, so everything is stopped, smashed out of the table, and we start from scratch at zero with something new. So probably you, Darren, I see that you agree with me. Unfortunately, this is happening. We are fortunate here with our general manager that we can do our projects and our programs together with our owners. When we presented it properly, we can really do this sustainable development of our programs and to adopt to the change situation, that our patients do not suffer, because at least if there was no possibility to go for the planned operations of their coxarthrosis or arthroses, they could come here and we were able to help them to achieve and to help them to improve the quality of their life, because there was not so much pain. So that was my, not question, but just a summary of my ideas, which you all have triggered, because it was really a great panel and a fantastic discussion. Thank you very much.
Thank you as well for these points and well, summary of the sessions that we discussed. We ran out of time, so I would like to thank you all for coming, and also that you actually tried to make our healthcare system better, and hope that when we meet next time, we'll be able to discuss what has improved, and the debate will be even more positive than today. So once again, thank you very much.
Thank you very much. And thank you all for your invaluable input and data, and to see your passion to make Slovakia a stronger country and a stronger player in the region. That's exactly what our chamber wants to do, to provide platform for businesses who are leaders in their sectors, bring them together, bring the public and private sector together to create opportunities, how to build back in a sustainable and better way. So once again, thank you very much, everybody, for coming, for accepting our invitation and supporting this event. Thank you, Andreas, very much for hosting. And I believe that next time we should come here for a week at least, because we have a lot of topics to cover, a lot of opportunities where we can collaborate and grow together. And thank you for your team, and for my colleague Diana Pokorna as well for all her help, and thank you for coming. So hope to see you soon. Thank you.
Thank you.